Hello, good afternoon. Flights to the UK from 6 African countries have now been suspended as the government tries to ensure a new variant of coronavirus does not reach the UK. In the past hour, Belgium has confirmed it's identified one case of the new strain, which is feared could be more transmissible than the Delta variant. While speaking in the House of Commons this morning, Health Secretary Sajid Javid said the UK must act now with caution.
We are concerned that this new variant may pose substantial risk to public health. The variant has an unusually large number of mutations. Yesterday, the UK Health Security Agency classified B11529 as a new variant under investigation, and the Variant Technical Group has designated it as a variant under investigation with very high priority. It's the only variant with this designation, making it higher priority than Beta. It shares many of the features of Alpha, Beta, and Delta variants. Early indications show this variant may be more transmissible than the Delta variant, and current vaccines may be less effective against it. It may also impact the effectiveness of one of our major treatments, Ronapreve.
Well, speaking earlier, the World Health Organization warned against hastily imposed travel restrictions, calling for countries to adopt a risk-based approach.
Countries can do a lot already in terms of surveillance and sequencing and work together with affected countries or globally to work scientifically to fight this variant and to understand more about it so that we know how to go about. So at this point, again, implementing travel measures is being cautioned against.
Well, as of midday, all flights from Namibia, Botswana, Zimbabwe, Lesotho, Eswatini and South Africa have been suspended. From Sunday, new arrivals in the UK will be required to quarantine in hotels. Those returning before then must isolate at home, while passengers who've come back from those countries in the last 10 days are being asked to do a PCR test. The South African government has criticised the travel ban, calling it rushed. Well, our correspondent Charlotte Nomers joins us now from the newsroom. So, Charlotte, what's causing the most concern then for government and scientists?
Well, as you heard from the Health Secretary, Sajid Javid there, the real cause of concern is the fact that this variant has such a high level of mutations, double the amount from the dominant Delta variant. And that means it's likely to be able to evade vaccines more easily and therefore spread more quickly between person to person. So that's why this is causing so much concern and why the government is acting quickly to try and contain the spread. They're imposing these travel restrictions on those 6 African countries and asking people to then quarantine as of 4 a.m. on Sunday in the hotels. So we're seeing the return of the red list. And while at the moment no UK cases, we are seeing this variant spread to others. And that's what scientists are worried about the rapid spread of this variant. And they're not taking any chances with it. We've also heard from the Health Secretary that they are open for discussion. Perhaps more countries will be added to that red list, and they're keeping all avenues open. And then we'll just have to wait to see, really. Not a lot is known at this current stage about this variant. It could take some weeks before scientists know more.
Charlotte, thank you. Now, scientists are concerned about the new variant due to the number of mutations that have been identified. Well, let's take a look now at what we know so far. 59 cases of the variant have been officially recorded in South Africa, Hong Kong and Botswana. But this figure could be higher and it's expected to rise. Scientists say the variant has 50 mutations overall and 32 on the spike protein, which is the target of the most vaccines, meaning that they could become less or even ineffective. Scientists also say the variant does show up on a PCR test. Well, our science editor, Tom Clark, has the latest.
It's certainly very concerning. There's no doubt about that. There's no other way of describing it. But we have to be cautious in sort of how we react to that concern at the moment, because we just don't know. And there have been very worrying-looking variants that have come along before and come to nothing. If you remember, the Beta or South Africa variant looked very concerning. caused a big surge of cases in South Africa, but it couldn't compete with the far more transmissible, infectious Delta variant, which we now live with every day in the UK and has become the dominant strain globally. But the reason for the concern with this one, it's got lots of mutations, twice as many mutations that are probably linked to evading the immune system and making it better at infecting cells than the Delta variant that's dominant. So theoretically, it immediately emerged as a concern. And what really changed things yesterday was when the South Africans used a new way of analysing their data to see that part of the spike of cases they're now seeing, particularly in Gauteng province, appears to be linked to this variant. They've seen a doubling in the number of cases of this variant, and that's what sort of caused the alarm. There are other epidemiological reasons for why that could be happening that's not linked to this variant being more transmissible, but we need to be prudent for the time being, hence the travel bans, hence the reaction we're having now. And remember, the government was definitely slow to act in delaying the entry of the South Africa variant, of the India variant, now Delta variant, into the UK. But remember, it's important to say we can't keep these things out. We know that travel bans aren't universally effective at keeping viruses out. This could slow it down and buy us some time, and that's why we're doing that while we figure out, in fact, whether it is going to evade our vaccines or cause us a particular problem. It may just, like others, not be able to outcompete Delta.